You can start now. हाँ सुरू करा.
Hello, Namaskar.
Hello.
Good evening, everyone.
Good evening.
Yes, and now I am Dr. Aditi Kulkarni from Kalyan, and I'm taking today's session on Man topic. Yes, that is means mind. Man means mind. In English, it is mind. What do you know about mind? Have you seen it? Okay. As per Ayurved, the basic of Ayurved is Swasthasya Swastharikshanam. That is aim of Ayurved, and its definition is Prasanna Atma Indriya Manaha. Samadoshaha, Samagnischa, Samadhatu, Malakriya means these all are physical characteristics. But Prasanna, Atma, Indriya and Mana. This Man is Prasanna is the most important indication of healthiness. Healthy mind is required for sound health. Okay. Then it is also called as Manas in Sanskrit. The health is incomplete without the incorporating the concept of Manas. And this mind includes physical, mental, spiritual, social, all types of man are included in this. Okay. Then we perform any knowledge when Atma is attached to this Manas, and Manas to the Indriya means sensory organs, and Indriya to the Indriyarth. This is the Jnana Prakriya means how we recognize, how we know the things. Means there is an apple in front of us. That apple is a subject. When we see that, when we look at that apple, at that time, our brain recognizes that this object is known as apple. We recall this, and then we understand that this is an apple. Okay, this is a Jnana Prakriya is explained in our text. In this, Manas, the sensory organ and object, this connection is because of the mind. When there is no connection, mind is wandering here and there is interruption in this process. So in our daily routine, we also simply call that, look at me. Or teacher always ask students, look at me, hear me, because you have to be careful that your mind should be there in while you are looking at that object. Understood? This process is a physical process, and when it hampers, so many diseases are formed, and we have to judge this process by the patient's symptoms while treating them in various diseases. Through the Indriya are in normal state, but the mind is affected, all the organs will be obstructed and the individual cannot perform any type of activity. This man or mind is an Ubhayatmak Indriya, means both. It is Jnanendriya, means it works as a sensory organ, and Karmendriya, that it works also. It is the prime cause for all the miseries, that is bandha and moksha, is because it is ubhayatmak indriya. As the darshans gives much importance to the adhyatmic tattva and manas is given equal place along with atma, they described and elaborated it as a moon. Acharya Charak has explained the sattva pariksha, means while checking patients, we have to judge sattva pariksha for the mind in a Dashavit pariksha. It is explained, it is one of pariksha, sattva pariksha. Mean what is the mind state we have to judge. Diseases are classified as manasik or sharirik, means mental disease and physical diseases because of variations of the rajo and tamogun of man, which leads to manas rog. Means whenever this patient comes to you, uh, take a simple example of IBS. IBS patients comes to you, he complains about his motions, the stool, the color, the effication times, and all these things. But at the same time, uh, we have to examine that these symptoms happens by physical disturbances of Vata Pitta Kapha doshas or by the anxiety, depression, fearness. Then we can conclude that this is with Manas Vyadhi or this is of Doshas Vyadhi. So it is very important to judge that this is because of uh, what? Sharirik or Manas. Then Vyutpatti of Man means etiology of Man is what? The word Manas is derived from the Man Dhatu and manas. It means by which knowledge is pursued. And manyate, jnanate, avabudhyate, anena iti manaha. This is Shabda Kalpadrum's definition. The meaning is the one which does manana, bodhana, and through which knowledge is pursued. By which Sukha Dukkhadi Jnanam is pursued, that is Manyate Jnanate Avabudhyate. Manyate Anena iti manam, the entity by which we think about everything, is mana. What is the place of mana? Kaha hai man? Where is it? Rudhayam Chetana Sthanam Uktam. Charak, Acharya Charak says, Rudhayam Chetana Sthanam Uktam, and Sushrut Acharya also says the same. Acharya Vagbhata says, Sthanoru Koshtamadhyagam. Sthan, Uru or Koshta. Uru means chest and Koshta. Between them is Manas. Shirastalvarantargatam. Manas is situated in the Shira and Talu. Means Acharya Bhel explained it as a Shira Talu. Shira means head and Talu. Okay. The synonyms of mana in our text, different Sanhitas, any types means Chitta, Chetan, Rudhayam, Rut, Manasam, Antarendriya, Sattva, Chet. These are the synonyms we found on in various different shlokas. We have to take care the references for that. Means the gunas of man means character anutvam ekatvam cha dvau guno manasa smrito. Charak Samhita Shariya Sthan. Anutvam and ekatvam. Anutvam means atomic dimensions and ekatvam means oneness or are considered to be the two specific characteristics of man. These are very basic characters of mind. If it were not so, all kind of perceptions would have occurred at the time. Means at a time, man do only one thing. This is the anutvam of man. Then sattva, raja and tama are the normal characteristics of mana. They are also called as trigun. Means sattva is guna and raja and tama are the doshas. Sattva is responsible for spiritual pleasure, correct knowledge, and the understand of that spirituality. Raja is responsible for the functional uh, of that individual, and Tama is for inertia and darkness. Now, Chintyam Vicharyam Uyyam cha Dheyam Sankalpamev cha. Chintyam means things requiring thoughts to think about, to do or not to do with purposeful or purposeless manner. Vicharya means it is a distinct analysis which enough to direct the mind to accept or reject a thing. Uyya, it is a speculation, hypothetical self-discussion and logical thinking about a thing. Dheya, it is the emotional thinking about the distinct thing. And sankalpa means it is a consideration, determination of mind about a thing. Okay, we will take this point in a description manner. Okay. Another mana karma is indriya nigraha. This indriya nigraha is very important point regarding of treatment. Means patient, we have to just observe patient and check that he can do indriya nigraha or not. In this Chintyam Vicharya Uyam, this karma is also we have to take care regarding treatment part. What are that? Chintyam means manasastu chintyam arthaha. Tatra manaso मनोबुद्धेश्च एव समान अतिहीन मिथ्या योगः प्रकृति विकृतो हेतवो भवन्ति चरक सूत्रस्थान. What does this mean? We have to take care that if patient is doing or maybe we also do something ati hino or mithya of a particular matter. If you are listening our audios, in that there is all description of vichar, thinking, vichar karne and vicharat rahane. That is chinta, thinking, and a thought and thinking. We have to differentiate in this process. So, chintyam artha means subject. If we are now we are taking the example of apple, then we are just thinking about apple we have to eat, not to eat, it will make cold. This is the chintan. And the decision, yes, I have to eat apple. I have to eat apple right now. The final decision is I have to eat apple only one bite. This is the step that Chintya Vicharya Uyya. This is a very simple and common example, but we have to apply this while treating patients. Again, Sushrut also explained that Shariram Chintyate Sarva Daima Manusha Sampada. Sarva Bhavai Yataha Tasma Shariram Vakhyasanaha. Chintan means vivaran. Chintan means सोचना, चिंतन means खोजना, This is the meaning of Chintan. Vicharya. Vicharya means vicharetum yogyam. Vichar means you have to take a decision. Decision by inquiring all the aspect of that subject. This is a vicharya. Okay, Chintam vicharya. Uyam. Uyam means उह्यनाम यत निबंधम ग्रंथे प्रज्ञया तर्कत्व उपदिश्यते means we have to uh, take a help of any basic concept, basic principle, basic siddhanta while taking a final decision. Dhyaya dhyan means what we have to decide the ob we have to decide what is our goal, what is our aim. And sankalpa means determination, final. I have to do this. That is a imagination. I have to do the final decision is the sankalpa. While treating patient, we have to take care that patient is lacking somewhere in this point. That he is doing excessive chinta, it causes then rasadhatu dushti. We have to take care of this anutvam ekatvam, this is in various another diseases happens, so we have to also take care and judge these points. Again, mana is explained as a basic dravya that explain once minute. It is considered as a dravya and Khadinyatma Manak Kalo Dishascha Dravya Sangraha. That is Charak Sutrastan reference. And in this, mana is considered as a dravya. Dravya means object, and we have to learn the Panchabhautik Svarup of that mana. What is that? That is Panchamahabhut uh, are considered as a manasthairya. It is a parthiv. Means whenever there is a chanchalatva, that is mind is going anywhere, like a ADHD patient, we have to think that there is a lack of stability, that is parthiva panchamahabhut is lacking, and so we have to think over that and do the needful. Same way the mano santapaha, that is a uh, Agni Mahabhut. Mano Mardava Kara, that is a Apya, means Jala Mahabhut. Glani Kara, Vichara Kara, Mano Laghavatvam, it is a Vayavya Mahabhut. And Mano Laghava Kara, it is a Nabhas, means Akashya Mahabhut. We have to correlate this Pancha Mahabhut with minds, these functions, with the help of this Man and Dravya Vichar, means Sadinyatma Manakkalu. Again, so to fulfill this, as it is a Dravya, then the all the Dravyas in this atmosphere are working on mind, and some are parthiv dravya, some aharya means dietary, some objects. Again, there is a some herbs, vanaspati are explained that helpful in this uh, type of patients we observe in our OPD. That is some jivaniya gan. These are jivaniya dravyas with help, which are helpful for nourishing the mind or give a jivaniya tattva to our mind. That is rudyam, rudayo manaso iti rudyam, means amla rasatmak, bitter gun, amla gun is amloruddhanam agraha. So the amra means lakucha, karamardha, these types of herbs are useful for these conditions. Again, truptigna gan, vishagna gan, शुक्रजनन गण, श्रमहर गण, वेदनास्थापन गण, all these rasayan dravya, nidrajanan dravya, these are ganas are helpful when we think that mana is a dravya and we have to take care of that particular thing. We can use this gana for the treatment. Okay. Any doubt or questions, or you can ask.
Yeah, ma'am. Can I ask about mind, man and woman mind in Ayurveda? Is it difference or no?
Mind and man and woman minds are different, are explained as per the Prakriti. That is Sattva, dominant Prakriti, Raja and Tama. These are the basic line of differentiation. Directly that women and men are not differentiated, but Ayurveda explains at the time of conceive, when before birth there is a conception period, and at that time the mindset of mother is depend by for making the baby's mind. So it make that prakriti of mind is different, not a main mind and woman mind.
Okay, thank you so much, ma'am.
There is a sattva is explained as a name sattva, that is a rajasiya sattva, paurushiya sattva, arsha sattva. These also another topic to explain, that gandharva sattva, and from that we also judge the mindset of that patient.
Okay, thank you. Thank you.
No other question? All of you understood? Okay, shall we stop?
Thank you, doctor.
Okay.
So we can end this session.
Thank you, sir. Thank you all of you.
Thank you